Donnatal contains several medications, belladonna alkaloids made up of the drug hyoscyamine, atropine, and scopolamine, and phenobarbital. Belladonna alkaloids help to reduce the symptoms of stomach and intestinal cramping. They work by slowing the natural movements of the gut and by relaxing the muscles in the stomach and intestines. Belladonna alkaloids belong to a class of drugs known as anticholinergics, antispasmodics. Phenobarbital helps to reduce anxiety. It acts on the brain to produce a calming effect. Phenobarbital belongs to a class of drugs known as barbiturate sedatives. How to use. The dosage of Donnatal tablets should be adjusted to the needs of the individual patient to ensure symptomatic control with a minimum of adverse effects. Adults 1 or 2 tablets 3 or 4 times a day, according to condition and severity of symptoms. Contraindications. Glaucoma, obstructive neuropathy, for example bladder neck obstruction due to prostatic hypertrophy, obstructive disease of the gastrointestinal tract, acynachalacia, pyloroduodenal stenosis, etc., paralytic ileus, intestinal atony of the elderly or debilitated patient, unstable cardiovascular status in acute hemorrhage, severe ulcerative colitis especially if complicated by toxic megacolon, asthenia gravis, hiatal hernia associated with reflux esophagitis, in patients with known hypersensitivity to any of the ingredients. Warnings. Donnatal tablets can cause fetal harm when administered to a pregnant woman. Diarrhea may be an early symptom of incomplete intestinal obstruction, especially in patients with colestomy or colostomy. In this instance, treatment with the drug would be inappropriate and possibly harmful. Phenobarbital may decrease the effect of anticoagulant and necessitate larger doses of anticoagulant for optimal effect. When the phenobarbital discontinued, the dose of the anticoagulant may have to be decreased. Adverse reactions. Adverse reactions may include xerostomia, urinary hesitancy and retention, blurred vision, tachycardia, palpitation, mydriasis, cycloplegia, increased ocular tension, loss of taste sense, headache, nervousness, drowsiness, weakness, dizziness, insomnia, nausea, vomiting, impotence, suppression of lactation, constipation, bloated feeling, musculoskeletal pain, severe allergic reaction or drug idiosyncrasies, including anaphylaxis, urticaria and other dermal manifestations, and decreased sweating.